This presentation is on evidence-based practice on the effects of hand washing. The objectives of this class will be, when you take away from this class will be identify the impact evidence-based practice has changed how hygiene is performed, develop an understanding of hand hygiene, identify 2 reasons when hand hygiene should be performed, identify at least 3 concepts of effective hand hygiene, and develop an understanding of performing hygiene using soap and water. Evidence-based practice show that the most common way to spread bacteria is with the hands. That's why it's important to wash hands before and after each patient and when they are visible or not visible to germs. Good hand hygiene is the single most vital, simplest, and less costly means of decreasing the spread of bacteria. Can y'all tell me why you think it might be the least effective? So that's why they're saying it's the least effective and least costly. Hand hygiene is the most effective way to help prevent the spread of germs. It cannot be said too often that hand washing is the most important and most basic technique in preventing and controlling infection. It is the single most effective infection control measure. Hand hygiene can be defined as hand sanitizing technique which reduces the spread of bacteria. It helps keep you healthy by reducing the spread of germs to family, friends, co-workers, and patients. Hand hygiene applies to either hand washing with plain soap and water and use of aseptic techniques. Hand scrubs include waterless, alcohol-based products. Because when you start working into the hospital, you're going to see a lot of patients with MRSA, staph, and C. diff. And you don't want to take it to your family. So it's very important that you wash your hands prior to going to a patient room and when you leave going out of the patient room with the hand sanitizer. Purpose of hand hygiene. The purpose of hand hygiene are hand wash to prevent infection, avoid pathogenic microorganisms, and to avoid transmitting them. Evidence-based practice of hand hygiene. Healthcare associated infections account for approximately 80,000 deaths per year in the United States. That is because, staph infection, MRSA, if you don't wash your hands, you're taking it from one patient to the next patient. And that right there spread is just keep going, because we're not washing our hands. And that's very important while we wash our hands. Healthcare associated infections range from 1.7 to 23.6 per 100 patients. It costs hospitals about $28.4 to $33.8 billion linked healthcare associated infections in 2007. These infections could have been prevented only staff would have done effective hand hygiene. Because evidence shows that effective hand hygiene helps reduce the transmission of germs and bacteria to other individuals or patients. When hand hygiene was conducted effectively and correctly among healthcare professionals, the percentage was low, ranging 39%. The link between hand hygiene and improvements in healthcare associated infections is hard to prove definitely. In modern day healthcare, however, the importance of hand hygiene is universally acknowledged by organizations such as the Joint Commission. You'll get to know them because they'll be in your hospital surveying. World Health Organization, which is called WHO, and the Center for Disease Control, CDC, when recommended or require health hygiene practice and intervention to improve hand hygiene compliance in order to reduce healthcare acquired infections. When should hand hygiene be performed? Before touching a patient, before a clean or aseptic procedure, after a body fluid exposure risk, after touching a patient, after touching patient surroundings. That's like you go in the patient room and they have a cup there, or they have their water pitcher, they want you to hand them their phone or something like that. Make sure you clean your hands. After using the bathroom or blowing nose. Now I have seen some that don't even, when they sneeze, they just keep working. Some staff members, and they don't even wash their hands. But you spread the germs on another some equipment that somebody else gonna come behind you and touch. So make sure you wash your hands using the hand sanitizer. And before handling food, drugs, or cleaning supplies. How to do hand hygiene using alcohol-based hand rub. And you will find this information on in your book on page 558. hygiene using alcohol-based hand rub. Apply product to the palm of your hand using the amount of product recommended on the package. It will vary according to the manufacturer, but usually is 1 to 3 milliliters. Rub hands together. You want to make sure to cover all surfaces of the hands, fingers, and between fingers. Also want to clean the fingertips and area beneath the fingernails. Rub until hands are dry. That's usually 15 seconds. Performing hygiene using soap and water. You want to make sure you get your necessary supply, which is paper towels, non-antimicrobial soap, and oil-free lotion. Do not use lotion that has oil because that breaks down the contents of your gloves. So make sure you use oil-free lotion if you want to use some lotion. Do not let the clothes touch the sink. For instance, say if I go in there and have my lab coat on, and my coat touch the sink, I'm just contaminated myself, my coat, because the sink is considered contaminated with germs. Remove jewelry. Healthcare workers should not wear excessive amount of jewelry. A plain wedding band may remain in place. If jewelry was worn, if you wore jewelry while you're taking care of a patient, doing the care, you want to make sure that you wash your hand, keep that jewelry on and wash your hands, wash that jewelry, your ring, but around it. So you don't, because bacteria can get on your ring. That's why we ask you to just wear a plain wedding band. Don't wear these rings that have high up things because germs can actually get in a ring and it can tear your blood. So make sure if you're married, just wear your plain wedding band. And don't wear all these bracelets when you're going to clinical. Just don't think you need your watch. At least when you're in the working field, in the hospital, just wear your watch and your wedding band. That's it. You want to turn the water on and adjust water force. Regulate the temperature of water until the water is warm. Why do you want the water to be adjusted? Because it will, the water will splash back from the contaminated sink and will contaminate your clothes. Warm water is more comfortable and is less likely to cause open pores and remove oils from the skin. Bacteria can lodge in roughened and broken areas of chapped skin. Wet hands and wrist area. Keep hands lower than elbows to allow water to flow toward the fingertips. Water should flow from the cleaner area toward the more contaminated area. Hands are more contaminated than the forearm. Lather hands with soap and rubbing with firm circular motion. You want to use 1 teaspoon of liquid soap from the dispenser, making sure all areas of the hand is covered. With firm rubbing and circular motion, wash the palms of the back of the hand each finger. The areas between the fingers and the knuckles, wrists, and forearms. Wash at least 1 inch above each of the contaminated, even if the hands are not visible soil. Because a lot of people say, well, I don't see anything on my hand, but there are germs on your hand. If you're working in the hospital, there are germs everywhere. So you want to make sure you wash your hands, okay? Friction caused by firm, rubbing, and circular motion help to loosen dirt and bacteria that can lodge between the fingers and skin crevices or knuckles on the palm and the back of the hands and on the wrist and forearms. And this came from the CDC. Continue. Washing hand areas between fingers. Continue this friction motion for at least 20 seconds by singing the happy birthday song or roll, roll your boat. You want to go through it twice. Those songs. Roll, roll, roll your boat, either the birthday song. Length of hand washing is determined by the degree of contamination. Hands that are visibly soiled need a local scrub. Using fingernails to clean on the nails of opposite hand. Area on the nails has a high microorganism count. Bacteria may under the nails where they can grow and may spread to others. Do not wear artificial nails. Natural nails should be kept no longer than 1/4 of an inch long. I know a lot of us like to have our fingernails pretty with the artificial nails, acrylic nails, even the gel nails. But germs and bacteria can grow under there. So you don't want that where you losing your nail bed and stuff like that. You want to make sure that if you wear a fingernail polish, make sure it's clean, clear coat so you can see if any bacteria in there. Or you get a fungus on your fingernail. Okay? Want to pat hands dry. Rinse thoroughly with water flowing to our fingertips. Running water rinses microorganisms and dirt into the sink. Use oil-free lotion on hand if desired. I'm gonna go back to the front top where it says pat hand dry with a paper towel, beginning with the fingers and moving upward toward forearms and discard it immediately. Use another clean towel to turn off the faucet. Turn the faucet off with a clean paper towel, protects the clean hand from contact with a sore surface. Discard towel immediately without touching other clean hands. Patting the skin dry prevents chafing. Dry hands first because they are considered the cleanest and least contaminated area. Oil-free lotion helps to keep the skin soft and prevent chafing. Oil-based lotion should be avoided because they can cause deterioration of blood, what I said earlier in the presentation. Major concepts of hand hygiene. Transmission organisms by hands by health professionals. Pathogenic organisms are present on the patient's skin and objects in the environment, just like in the patient room or in the hallway or on the patient's bed. Some of these organisms are transferred to healthcare workers from their hands. Pathogenic organisms may become resident flora on some caregiver hands. Inadequate hand cleansing allow organisms to contaminate healthcare workers' hands. The germs that have contaminated staff hands must be able to live on the hands. A healthcare professional must either neglect hand washing or don't wash their hands correctly for the transmission of organisms. The methods of effective hand hygiene. Soap and water is considered the normal practice for hand washing. If healthcare professionals have jewelry on, it must be removed prior to patient care and hand washing. Skin breakdown on the hands may lead to bacteria colonizing the skin and the possible spread of blood-borne virus as well as other microorganisms. Sore hands may also lead to decreased compliance with hand washing protocol. If you have a sore in your hand, make sure that you put a Band-Aid on or cut or something, make sure you put that on there and stuff before you wash your hands, because sometimes the hand sanitizer will burn, okay? If healthcare professionals, alcohol-based agents may be used in the following situations. When hands are not noticeably dirty or soiled with blood or body fluids before interaction with patients and after interaction with patients. Selection of hand hygiene solution. Hand hygiene agents must be carefully selected in order to ensure compliance, efficiency, and safety for both the healthcare worker and patient. Several factors must be taken into consideration. You want to consider the cost of the agent, the ease of the use for healthcare workers, potential for dermal irritation and skin reaction, efficiency of the agent, product availability and accessibility within the healthcare facility, drying time necessary after applying the agent, staff support for the selected products. An evaluation of the agent should be done to assess the staff application of the product and to ensure a smooth transition. In addition, adjusting to prevent contact dermatitis such as hospital-grade lotion must be considered to ensure a low risk for adverse events. The main component in improving hand hygiene practice is the use of alcohol-based scrubs instead of using soap and water. Alcohol-based hand scrub requires not as much time, more efficient, and cause decreased irritation to the skin than washing hands with soap and water. When to use hand hygiene? After contact with body fluids or excretion, mucous membrane, broken skin, or wound dressing, and after taking off gloves. Availability of a hand hygiene solution. Hand hygiene products are available in a wide variety of forms to meet the specific clinical needs of the healthcare environment. Typical agents include plain soap, alcohol, iodine, and iodophores. Most products currently available to healthcare workers and hospitals are alcohol-based, as alcohol has significant activity against a wide variety of bacteria and virus. Now we will watch a video on hand washing.
Tamika, hands, when should they be washed?
According to the CDC, hand washing is required, using soap and water, of course, before eating, after using the restroom, and if hands become soiled with blood or bodily fluid or visibly dirty.
Good. Now, Paula, what's the right way to start washing your hands before you even turn on the water?
Well, definitely make sure you've removed any jewelry, and always keep your clothes away from the sink.
Good, and why is that?
Well, to prevent contamination of your clothes. And also jewelry can harbor microorganisms and contaminants.
Exactly. Robert, why don't you go ahead and turn on the water and be careful about the force of the stream so you don't splash your clothes. What's the proper water temperature?
Well, the water should be warm to the touch.
That's right. Okay, you're going to want to wash your hands, keeping your fingertips below your elbows because you want the water to run down toward your fingertips, all right? Now we have a soap dispenser here, but you may find yourself in a situation where there's a bar of soap. So what's the difference?
Well, with a bar of soap, you want to wash the soap before using it, and then wash it before returning it to the soap stand.
Good. It's important to get good friction going to loosen the dirt that can get into the skin crevices. Make sure you wash up to an inch above any visible dirt or an inch above the wrists. Take care to wash your palms, back of the hands, fingers, and the areas between the wrists, knuckles, and forearms.
Like this? I should use a firm circular motion, right?
Yes. Now use your fingernails of the opposite hand to clean under the other fingernails. How long should you wash your hands?
At least 15 seconds.
Yes, at least 15 seconds. Okay, Robert, you're going to want to rinse your hands thoroughly now. Keep your hands below the level of your elbows to avoid contaminating forearms or elbows. And once you're done, you're going to want to leave the water running while you get a paper towel or two. And why is that?
But you always have to consider that the sink itself is contaminated.
Exactly. So take the paper towels and begin to dry your hands starting at the fingertips and working your way up the forearms. Then you're going to want to use another paper towel to actually turn off the sink.
Ms. Swenson, is it alright if I use moisturizer? In the winter, my hands get really chapped.
Moisturizing lotions are fine as long as they're oil-free.
Well, if the sink isn't available, could you use one of those alcohol-based antiseptic solutions?
If your hands are not visibly soiled or contaminated with body fluid, then you do have the option of using an antiseptic hand rub. Can anyone tell us what we should keep in mind when using these solutions?
Yeah, there are different decontamination requirements at each institution, and we should be aware of the product label and instructions for the antiseptic hand rub.
Right. Okay, Tamika, how do we go about applying antiseptic hand rub?
All yours.
First, I apply the recommended amount of product into the palm of my hand, then rub the lotion into my hands with a circular motion, making sure to get into the same crevices that I would when washing my hands. I continue rubbing until the product is evaporated on my hands.
Excellent.
Do y'all have any questions? Now we're gonna do a demonstration of hand washing. And it's 10 volunteers. I'm gonna demonstrate to you all on how the proper hand washing technique, okay? You see, make sure that your clothes are not, and your jacket, if you have a lab coat on, it's not touching the sink, so I'm not touching the sink. And we're gonna cut the water on, we're gonna make sure we're watching the flow of the water. Okay, and we want the water to be warm. So I'm gonna wet my hands first. Give me some soap. Making sure my hands are down. I'm watching them, doing it with friction in the palms of my hand. Washing between my fingers. Then I'm gonna take the opposite hand. Wash on my finger, clean out my fingernails. Always have your fingertips holding down. Take your paper towel. You can take one or two.
Okay.
Discard this. Take another paper towel. And cut your water. Do y'all have any questions? All right. Now,